I'm Kieran McLeod, medical doctor from South Africa. I also have a diploma in primary emergency care. Spent quite a bit of time working in field hospitals and emergency rooms around South Africa. Got into health tech about 4 years ago, and I've been Heidi's medical knowledge lead since August last year. Interested in AI and obviously building solutions for clinicians to help improve their work.
Kieran, in your role as head of medical knowledge, how would you describe your role in obviously the amount of user feedback and requests for certain features that users give us to actually implementing it and fine-tuning and improving Heidi as a product?
Well, look, I would say it's a pretty integral part of it, mainly because I've only kind of worked in one discipline in healthcare, and we've got clinicians who are physios, vets, psychologists, naturopaths, and I've only got insight into kind of one area of medicine. So getting feedback from our users from those different domains across the board is pretty essential, because otherwise we would just have a product that's suited to only one clinical domain. In terms of what that looks like, so it's often kind of getting feedback from our customer support team, understanding what exactly our models are doing that could be done better in order to sort of help those clinicians in those fields. And often that goes to kind of tweaking prompts and creating a series of templates that are appropriate for that type of clinician in their field.
Now, it's safe to say that you're the brainchild behind the templates. Can you explain a little bit more detail about what goes into making a really good template?
Sure. I think templates are the best and worst thing that I have created at Heidi, but there's no doubt that templates are one of the things that help clinicians get Heidi to write the way they want it to. And so what it is on a very basic level is I have an idea about what I want my notes or my documentation to look like. I know what headings I want, the kind of content below each heading, whether it's written full sentences or bullet points. And essentially a template is a set of instructions to Heidi to say, this is what my notes should look like. This is where you need to put the information that we talk about in the consults, and then we feed that into one of our AI models, and it spits out either a note or a piece of documentation.
So you'd say it's part art, part medical knowledge, part science, part everything else, or how would you describe it?
Look, I think there's a fair amount of, there's a technical level to it. So it's understanding, I guess, the syntax of how a template works, using placeholders to say this is where the data should sit, and instructions, how should we interpret that data, what should we do if it's there or it isn't there. But there definitely is an art. And I always say, there's no such thing as a perfect note. Every clinician is going to look at a note and say, well, I would do this differently. And that, I think, is where the biggest challenge comes in, is trying to make something that works well for them and writes in the way they want it to, but still is kind of generalizable enough that it can be applied by a number of different clinicians across a domain.
I think that's an important point there. How do you find that balance between giving the note that the specific clinician actually wants and what's an acceptable standard within their jurisdiction about what needs to be in the note? How do you find that balance? Or do you, if someone asks you in the medical knowledge team, can you create me this template? Do you say sometimes or give feedback saying that's actually not a good note? How do you find that balance?
Look, it's tough because I think a lot of people believe that Heidi is going to solve all of their problems and it's going to be able to generate any piece of documentation that they want, and that's going to be written in exactly the way they want it to be. And in practice, that's nearly impossible. So we're really trying to, I guess, just find the 80%. Can this note or piece of documentation include all of this sort of necessary elements in such a way that when you read it, you go, yes, this has got an acceptable level of detail that I'd be happy to put my name behind this and put it into the electronic medical record, or put it into a referral letter to send off to a fellow clinician. I think to continue on, there are obviously some asks that come from clinicians where we're always a little bit wary. We're here as a documentation assistant. We're not here to take over clinical decision making. And so often some of our users say, well, can I get Heidi to do this? And that's often where we sort of have to draw the line and say, well, look, this is what the intended use case is. you know, we're not there to make your clinical decisions for you. That's what your role is as the clinician. We're just here to make your documentation that little bit easier.
I think that's a really good segue to part of your role, medical knowledge, but another important role you have here is as the head of clinical safety and our clinical safety officer. So how do you handle those conversations? Like you said, when people are saying, I want Heidi to spit out a list of diagnoses for me, or I want Heidi to do something that are explicitly against our terms. How do you balance ensuring that Heidi's a clinically safe tool, but not also annoying a user who says, I need this? How do you find those conversations?
What usually helps just to actually have a conversation with them in the first place. Because again, they often, you know, may come in with this agenda and like, this is exactly what I want Heidi to do for me. But we obviously, you know, want to make sure that our tool is used responsibly. And so often it is just kind of trying to outline as clearly as possible, like this is actually what the tool is meant to be used for, you know, and there is a fine line between, you know, this model kind of taking the wheel and, you know, doing all of these tasks, but in a relatively unsafe way. And my concern is always that, you know, we shouldn't be offloading the decision-making that we've been trained for to a machine, at least not at this point in time. You know, yes, if it's there to take notes for you, that's incredible. But if you are using it as a way to essentially do your clinical reasoning and decision-making for you, that's problematic, especially because, you know, these models are great at taking what you've said and transforming that into a comprehensible note. But there is obviously an element of sort of hallucinations and mistakes that AI can make. And, you know, making a mistake about documenting one piece of the history is one thing. It's another thing entirely to have a model make a mistake in the treatment plan for a patient, and that actually ends up resulting in harm to the patient. And that's really what we want to avoid, and what I try to kind of make clear to anyone who's saying, I want to use Heidi for this. It's not what we want you to use it for. It's there to help with your documentation.
Yep.